I'm Becky Malby, I'm the Director of the Centre for Innovation in Health Management at the University of Leeds, and we host the new Leeds Institute for Quality Healthcare. And the point of the Institute is to enable clinical folk, doctors, nurses and therapists, to make fabulous decisions with patients and carers based on good data. So at the moment we have very little costing data and we have some quality data, but we don't have that laid out in the conversation between patients and carers and the clinicians they're working with so that they can make good choices together. And what we know is that where you have that conversation, those choices are made, you get better outcomes for patients, that patients get cared for in the way they want to, they own those decisions better, and they tend to look after themselves better. So we expect that we'll get much better value and much higher quality if we take that process.
It's been an amazing couple of hours with a huge number of the main clinical and managerial leaders across Leeds here talking about how we can improve quality to make our healthcare system better but also financially sustainable for the long term.
Today's event saw Dr. Brent James from Intermountain Healthcare in Utah, who gave a series of lectures on the approach that they have taken to improving quality for patients. Importantly, at a time of financial austerity, he also demonstrated to a large audience of in excess of 100 people that you can deliver higher quality care for patients at lower cost.
The conversation around the Intermountain approach and the opportunity that the Leeds Institute will offer across the Leeds Health Service and Social Care Service seems to be really exciting people. The conversation is probably around the three priorities, how we move those forward at a pace and how we can bring in other priorities. People just seem to be really enthusiastic.
So the Institute's going to do a number of things. It's going to go after data. We're going to try and find the data that we need on which to make these types of decisions. We're going to have some shared models of improvement across primary care, so general practice, and across secondary care, and across social services, and across the third sector, so that we all have exactly the same way of improving our services in the same language and are working together to do that. So that's a really important part.
We intend over the next 12 months to develop specific programmes of work that we anticipate will significantly improve the quality of care for patients, to avoid hospital admissions, improve their outcomes, and also expect to save money at the same time.
We're going to improve our ability at making decisions with patients. So rather than potentially treat people as if they aren't authors of their own story, but to do it in a much more partnership model. And the last thing is that we're going to have conversations with people that lead and manage the system to help unlock the things that get in the way of clinicians and patients being able to do the best they possibly can together.
Huge amounts of energy. You can probably hear behind me some of the people still hanging around, still talking, still asking questions. So let's hope we can build on the enthusiasm of today for a long-term future for the NHS in Leeds.